Gracias por acompañarnos hoy. Este seminario se
Thank you for
ofrece en
joining us
español e inglés.
today. We are
Si
offering this
desean escuchar en
seminar
inglés,
in English and
miren la parte
Spanish.
baja de su
If
pantalla
you would like
donde
to
está
listen
un
in
botón globo
English,
que
there
dice
is a globe button
interpretación.
at the bottom of your screen that
Luego
says
seleccione inglés.
interpretation. If you
Cada
press it, you can
presentador dará
select
la orden,
English.
pero escucharán
That
información
way you
en
can see the
inglés.
presenters, but you can
Pueden
listen
simplemente
in
regresar al
English.
inglés ahora.
So I'll
Hello
repeat this
everyone, thank you
in
for joining us today.
English right now.
This webinar is being provided in English and in Spanish. If you would like to listen to the webinar in English, please select the globe button at the bottom of your screen, labeled Interpretation, and select English. You'll be able to see the presenters, but you will listen to the webinar in English. Este programa se está llevando a cabo en colaboración con Memorial Sloan
This
Kettering,
program is
también
a
llamado
collaboration between
MSK.
Memorial Sloan
Antes de
Kettering,
empezar
also
el
known as
programa, me gustaría
MSK.
hablarles un poco sobre
Before
la
we
Oficina
start,
de Equidad
I'd
en
like
Salud de
to tell
MSK
you a little
y un
bit
poco
about the
sobre
Office of
SHARE.
Equity from MSK and
La
SHARE.
Oficina de Equidad en Salud de MSK fue
MSK's
establecida para
Office of Health
abordar
Equity
disparidades en
was
los resultados
established
de
to
cáncer
address
en función
disparities
de
in
la raza,
cancer
la etnia,
based on
las
race,
creencias culturales y
ethnicity,
el nivel
cultural
socioeconómico.
differences,
La
and
Oficina de Equidad en Salud a su vez
socioeconomic
tiene
status.
tres áreas de
The
enfoque:
Office of Health Equity has
acceso
three
de los
areas of
pacientes,
focus: patient
investigación y
access,
capacitación.
research,
Si desean
and
obtener más
training.
información, pueden
If you'd like more
visitar la página
information,
web
you
de
can
MSK.
visit MSK's website.
SHARE es una organización nacional sin fines de lucro que
SHARE
apoya,
is a national
desarrolla y
nonprofit
empodera a cualquier
that
persona que
supports
no
and
tenga
empowers
cáncer de seno
anybody who
o
is
cáncer
diagnosed with breast
ginecológico.
cancer or
SHARE
gynecological
también brinda
cancers.
información al público en
SHARE
general sobre
also
los signos
offers
y síntomas
information to the
del cáncer,
general public
porque
about
nadie debería
signs and
enfrentar
symptoms of
cáncer
cancer
soledad.
because nobody should have to
Si
face
desea más
cancer alone.
información sobre SHARE y nuestros
If you would like
servicios,
more information
también
about
pueden
SHARE and our
visitar nuestra página
services,
web.
you can also visit our webpage.
Todos los participantes serán silenciados durante la
We are going
presentación.
to mute all
Una vez que las oradoras
participants
terminen de
during the
presentar, vamos a
presentation.
empezar la
Once the
sesión de
speakers are
preguntas y
finished, we are
respuestas.
going to have a
Pueden
Q&A
enviar sus
session.
preguntas en la
You can
sección de
submit
preguntas y respuestas
questions
en el menú en la parte
through
baja de
the
su pantalla.
Q&A button at the
Les
bottom of your
queremos informar
screen.
que las oradoras
We want to
no
let you
pueden
know
dar
that the
consejos
speakers
médicos específicos,
cannot give any
por lo que les
specific medical
recomendamos que
advice.
envíen
So we
preguntas generales.
recommend that the questions remain general.
Este programa está siendo grabado y pronto
We
estará
are
disponible
recording
en las
this
páginas de web
program
de
and it will be
MSK y de
available
SHARE.
on MSK's and SHARE's web pages.
Antes de comenzar el programa, nos
Before we start the
gustaría
program,
saber un poco más de ustedes en la
we
audiencia.
would like to know a little bit
Por
about
favor,
you,
tomen un
our
momento para
audience.
responder a las
Please take a
siguientes dos
moment to
preguntas
answer
breves.
the following
Su
two
información no será
questions
compartida
briefly.
fuera de este programa.
We will not share your responses outside of this
La
program.
primera pregunta es,
The first
por
question
favor,
is,
cuéntenos de usted.
please tell us about
Déjenos saber, por
yourself.
favor, si usted es un
Let us
paciente,
know if
un
you're a
cuidador,
patient,
un
a
familiar o
caregiver,
amistad de
a
alguien que
family member,
sufrió de
or
cáncer,
maybe a
o si
friend
es
of
un
someone who's had
profesional de
cancer,
salud mental.
or if you are a healthcare professional.
La segunda pregunta es,
Second
¿está
question
familiarizado
is,
con los
are
servicios
you
de navegación
familiar
del
with
paciente
patient
o sus
navigation
derechos legales?
services and with your legal rights?
Vamos a dar unos momentos para contestar.
So I'll give you all a few minutes to answer.
¿Qué? Vemos que el 83% de
Okay,
ustedes
we
son
see that
pacientes
83% of you are patients
y el 60% de ustedes sí están
and
familiarizados con sus
60% of you
derechos
are
legales y
familiar
con los
with your legal
servicios de
rights
navegación al paciente.
and patient
Gracias
navigation
por
services.
contestar
Thank
estas
you
preguntas.
for answering our questions.
Ahora me gustaría darle la palabra a nuestra primera
Now I would
ponente
like
de
to
hoy,
hand it over
la
to our
doctora
first
Lisa
speaker
Diamond.
today, Dr. Lisa Diamond.
Gracias. Voy a compartir también.
Thank you. Give me 1 second. I'm going to share my screen.
Okay. Hola, soy Lisa
Okay,
Diamond.
hi,
Soy
I'm
médico
Dr.
y
Lisa Diamond.
investigador en
I am a doctor
Memorial
and
Sloan Kettering,
researcher
MSK,
at
en
Memorial
el
Sloan Kettering,
servicio
MSK,
de Disparidades y
and I'm
Inmigrantes,
on the
y salud
service
de
of
inmigrantes.
immigrant
Estudio
health and
cómo
cancer
hablar el
disparities.
mismo idioma que su médico puede ayudarlo a comprender las opciones
I
de
study
atención
how
y
speaking the same
mejorar su
language as your
tratamiento
provider
médico.
can help
Mi
you
trabajo
understand better
ayuda
your
a
treatment
que la
options
atención sanitaria
so
sea
that your
más
health care
acogedora para personas de
is
diferentes
more
culturas.
accessible for people of other cultures.
Voy a hablar hoy de su derecho a
I'm going to
solicitar
talk
un
now
intérprete
about your
médico.
right to request a medical interpreter.
En Estados Unidos hay más de
In
25
the
millones de
United
personas
States,
que
there are
tienen
more than
un
25
dominio
million
limitado
people
de inglés.
who have
Esto
limited
qué
English
significa es
proficiency.
que dicen que hablan inglés
This
menos que
means
muy
that they
bien.
speak English
Hay
less
6
than very well.
millones de personas que hablan más de
There are 6
un idioma
million
que viven en
people
Nueva York.
who speak more
2
than one
millones de
language living
ellos
in New
dicen
York.
hablar el inglés
2
menos
million
que
of
bien.
them
Sin
speak
duda,
English
con
less
tantas
than very
personas
well.
en la ciudad con
With
dificultad
so
para
many
hablar
people in
inglés,
the city with
habría
difficulty speaking
dificultades
English,
cuando
there must be
visitan a sus
difficulties
médicos.
when
Es obvio
they
que
go
hay
to their medical
necesidad
appointments.
de aliviar
So
esta
there is the
dificultad
necessity
para que los
to
pacientes se
relieve this
sientan seguros
difficulty for them
comunicándose
so that
con
they
sus
feel
médicos.
comfortable communicating with their doctors.
Las investigaciones sobre los efectos del
Research
dominio
studies
limitado del inglés muestran el
about limited
efecto
English
que
proficiency
eso tiene en su salud.
have been done
Personas
about the effects
reciben información sobre
that
su
this can show
identidad
in your
a
health.
un ritmo más lento, tienen menos probabilidades de
We
comprender
see that these
información de salud
patients have
importante,
less likelihood of
tienen
understanding
menos
important medical
acceso al
information.
seguro médico
They have
y a
worse
la
access
atención
to
médica,
health insurance
reportan
and health care,
comunicación médico-paciente insatisfactoria,
and report
de
less
baja y de
satisfaction
baja
with
calidad,
patient-provider
y
communication
corren
and
un
less
mayor
quality,
riesgo de tener salud de menor calidad.
including a higher risk of having worse
Todos
health.
quieren comunicarse de manera fácil con su
Everybody wants to
organización
communicate
médica,
easily with your
pero
healthcare
cuando
team.
usted se siente más cómodo
But if you feel more
hablando un
comfortable
idioma que no es inglés,
speaking a
usted puede
non-English
solicitar un
language,
intérprete
you
para que
can
le
request
ayude
an
a comunicarse
interpreter
con su
so that
equipo
they
de
can help
atención
you communicate
médica.
with your medical
Usted
team.
tiene el derecho de
You have
solicitar
the
un
right
intérprete
to
médico
request an interpreter,
cualificado
a medical
de
interpreter
manera
who is
gratuita.
qualified, free of charge.
Por esta razón, hay
For
reglamentos
this
que
reason, there are
mantienen su derecho
regulations
a solicitar un
that
intérprete
maintain your
médico.
right to a medical
La
interpreter.
Ley de Derechos Civiles de
The
1964
Civil Rights
prohíbe
Act
que
of
el gobierno
1964
discrimine
prohibits
en
that
base a
that the
ningún
government
demográfico
discriminate
y
against
requiere
any
que el
demographic
Departamento de Salud
and
y Servicios
requires
Humanos
that the
mantenga servicios de
Department
asistencia
of Human
lingüística de
Services
manera gratuita.
provides linguistic
La
services free of
Comisión
charge.
Conjunta en base a la Ley de Derechos Civiles dice que es imperativo que médicos
It's
y pacientes
imperative
se
that
comuniquen
patients
bien
and
para su salud.
doctors communicate well
En
for their
2006,
health.
la ciudad de Nueva
In
York
2006, New
aprobó
York
una ley
City approved
que
a law
mantiene su derecho de acceder y
that
a
upholds
intérpretes
your
y
right to
traducciones en su idioma
interpretation
de
and
manera gratuita.
translation in the language that you
Recientemente,
prefer
en
free of charge.
2022,
And
el
recently, in
Estado de Nueva York
2022,
ha
the state of New
afianzado
York
esos reglamentos,
has also taken up
requiriendo
those
que todas
laws
las agencias del Estado que
requiring
trabajan
that
con
all
públicos
state
deben mantener
agencies
acceso a intérpretes
should
y traducir
uphold
sus documentos
access to
a los 12
interpretation and
idiomas más
translation of
usados en el Estado.
documents to
A través de estos
the
reglamentos,
two most common
MSK
spoken languages
se
in the United
compromete
States.
a proporcionar servicios
MSK
de
is
asistencia lingüística
committed
para que sus
to
pacientes
providing
puedan
linguistic
comunicarse con sus
assistance
médicos
so
de
that
manera
patients
fácil.
can easily communicate with their providers.
¿Para qué usar un intérprete?
When
Un
would an
intérprete
interpreter be
médico le
used?
puede ayudar
A medical
a
interpreter
hacer
can help
preguntas y
you to ask
expresar
questions
inquietudes en su
and
idioma,
express concerns in your
comprender los
language.
resultados de los análisis
Understanding test
y lo que
results
significan en su
and
idioma.
understanding what
Hablar
that all means in your
abiertamente
language.
sobre otros
This way,
problemas
you're able
que
to
afectan su
speak
salud y
openly
calidad de vida.
about your health and your quality of
Un
life.
intérprete médico le puede
A medical
ayudar a su
interpreter
equipo de atención médica a
can help your medical team to obtain your medical history in a more complete way, answer all of your questions, address your concerns, explain your medical problems and how they should be treated, communicate next steps and follow-up appointments, help the doctors to understand better your cultural history as well. Working with a medical interpreter can reduce medical errors, increase satisfaction with healthcare, help you to better manage your symptoms and your care. Do I need a medical interpreter? If you speak some English, it's possible that you might not understand everything that the doctors tell you. Or if your doctor speaks your language, it's also possible that the doctor doesn't understand everything that you say. The interpreters are available to help you communicate and understand everything necessary in a medical appointment. You might need an interpreter to communicate at the reception desk, to speak with a technician, if a procedure is being done, or with a pharmacist, especially if they review medication instructions with you. Anybody at your medical appointment can request an interpreter at any time. For example, let's say that a mother comes to the pharmacy to pick up an inhaler for her daughter who has asthma. She speaks a little English, and she can say to the pharmacist all of the information about her daughter in order to pick up the medicine. But when the pharmacist starts to review the instructions about how to use the inhaler the correct way, she doesn't completely understand what she says. The mother lets her daughter use the inhaler in a way that's not quite correct. That way, if the inhaler doesn't work during an asthma attack, the mother has to then take her daughter to the emergency room. There, they tell the doctor how they were using the inhaler, and they find out they weren't using it the correct way. In this example, the mother would have really benefited a lot from having an interpreter during her conversation with the pharmacist in order to avoid this costly visit to the emergency room. So remember, in any moment during a medical appointment, you can request an interpreter to help you. You should not feel embarrassed for asking for help because there can be risks if you don't.
Can a family member or a friend help interpret for me? Your support team, emotional support team may have good intentions when they want to interpret for you, but there's certain terminology that may be difficult to translate accurately. There's also a chance that your family member may not interpret accurately what the doctor is describing. And apologies, because this person may have a different opinion on the issue, or it may be embarrassing or difficult to say it out loud in front of you. Culture can play a significant role in situations like this. A medical interpreter can help. Okay. Your friends and family can participate in the visit, of course, if there's an interpreter present and they can provide emotional support. Medical information is complex, and medical interpreters have trained to carry out this difficult task. They go through a training program that educates them on the regulation on medical ethics and medical terminology that could allow them to support you and the healthcare team during your visit. These medical interpreters have trained in a way that your family members and your friends have not. Medical interpreters follow federal regulation that are in effect to protect you and your health. And here we have an example. Just to illustrate this, would be the case of a man that has prostate cancer who is visiting the doctor for follow-up visit. He comes in with his daughter. He does not speak English, but his daughter does. And during the entire visit, the daughter acts as an interpreter. However, when the doctor asks the patient on his sexual activity throughout the treatment, the daughter is not using the appropriate medical terminology and just ask these questions very quickly. A medical interpreter is trained to manage these situations that are very tricky and delicate and to formulate every question accurately. In this case, the use of an interpreter guarantees that the doctor has a clear comprehension on the sexual health of the patient and spares the daughter a very uncomfortable situation. Will there be an interpreter in the room with me? It's possible that an interpreter will be in person in the exam room with you. That will be very useful to establish a relationship with your medical team. However, most frequently we have interpreters participating through video or through the phone. These other interpretation methods also allow for quality communication and satisfactory medical visits. Research shows that both doctors and patients consider phone and video interpretation useful. When you use an interpreter, speak to the doctor as if you were speaking the same language as the doctor. Think of the interpreter as someone through whom you're speaking, instead of someone that's speaking on your behalf. Concerns on your migration status during a medical doctor's visit, and this is a very normal concern, and it's important to understand your rights in the exam room. In the doctor's office, your migration status is considered protected medical information, PHI, and according to the law called HIPAA, your doctor legally cannot reveal your migration status, and doctors work with interpretation agencies that observe HIPAA regulations so that your interpreter will also keep your information protected by law. Any information that you provide will be kept strictly confidential. You may request a medical interpreter when you make an appointment, when you're registering at the front desk, or at any time during your visit. Better communication means better health. That's all from me. Thank you. Thank you, Dr. Diamond. We will now hear from our second speaker, Sandra Morales.
Sandra está en mute.
You're muted, Sandra.
Disculpen.
Apologies.
Buenas tardes.
Good afternoon. My name is Sandra Morales. I'm a patient navigator, certified medical navigator. I'm currently working in the patient navigation chair. I would like to tell you about my personal experience as a Spanish speaker in the United States and regarding my work with the Latino community. I work directly with cancer patients. I started when I was working in the breast surgical oncology department at Mount Sinai. I was working with patient navigation. And then when I was becoming certified, I combined the role as medical interpreter and patient navigator for 7 years. And I started working with Share 10 years ago when I was diagnosed with breast cancer. And I, at that time, I faced with one of the biggest challenges in my life, because when you get a diagnosis as this, I mean, I was so concerned, I was so scared, because as I was facing such serious condition in a country where I still did not really understand how the healthcare system worked, and the language really represented a persistent barrier for me. So after learning about my diagnosis and received chemotherapy, surgery, breast reconstruction, radiation therapy, hormone therapy, this was a process that was filled with both physical and emotional challenges. And I remember very vividly that my oncologist was very honest with me and gave me a very discouraging prognosis with low chances of cure. And I felt fear and distress, not only for what the condition meant for me, but especially for my family. So unfortunately, I was blessed to have the unconditional support of my husband. And since he was born in this country, he has a perfect command of English, and he has good understanding of the healthcare system here because of also his professional career. So his experience was crucial to help me navigate this really complex journey. But there was time where the complexity of the system and the language barrier made me feel lost. It made me feel overwhelmed and frightened. In those moments of uncertainty, I thought, well, if I'm able to overcome this condition, and I should be able to use this experience to have a positive impact on others and to help people that may have been facing the same fears and challenges that I had experienced. So I started to participate in the support groups in Spanish and at Share. I realized that many Latino women shared similar experiences. We were sharing our experiences, our challenges and difficulties. I felt that the most common frustration among us was lack of information in our language. The language barrier became a huge obstacle to receive adequate care and to understand the treatment for many of them. So as I became more involved in events regarding breast cancer and education, I realized that many women not only were facing breast cancer, but they did not really understand the medical terminology, the post-op instructions, or even very important details regarding their treatments. And on many occasions, they're in a waiting room for a follow-up visit. I met other Latina patients, and when they realized that I spoke some English, they would ask me translate certain terminology or to ask questions at the front desk or to request an appointment with specialists and so on. So after I became aware of access equity to medical care and other terminology, I had already identified that language was a huge barrier, and it wasn't really necessary to study that field to realize there was a situation whereby many patients did not really know accurately what their treatment plan was. So that pushed me to work directly with my Latina community, and I became an ambassador at Latina Share. For several years, one of my main responsibilities was to conduct weekly visits at Latino consulates to give talks to the community on how to recognize ovarian cancer symptoms, breast cancer symptoms, and other gynecological cancers. And our goal is to promote early prevention and to educate the community on the different types of treatment and to share written information on these conditions and the resources available for the community in Spanish. At present, as a patient navigator at SHARE, I have the chance to work directly with people that, just like me, at the time, are not only facing a serious condition, they're also facing cultural barriers and language barriers. So, at my job, I always carry out an assessment that's based on the patient, recognizing their strengths and their needs, taking into account the psychosocial and cultural factors that are multiple, so that I can identify barriers and ways in which I can provide support and establish a plan to help them with their medical care and reduce and overcome barriers. When I carry out this analysis, I can communicate with the clinical team any clinical concern that I may find during this evaluation that's patient-based, ensuring that the patient receives every guideline and support that they need during their treatment. It is also during this assessment where I find out whether the patient has communication issues or not. And why is this so relevant? Why is communication so relevant? Because without English proficiency or a command of English, Spanish speakers may have difficulty to communicate accurately with healthcare providers. As Dr. Diamond, it could lead to misunderstandings on when symptoms are being conveyed. But more importantly, is the nuances of medical terminology that are missed, and not every hospital has qualified interpreters. And without those services, patients have to rely on family members or friends for interpretation. That can lead to errors, significant errors in interpretation. Many documents, patient education are only in English.
And those patients will have difficulty understanding those forms, filling out information about their feelings, and especially going forward, their care information. It's important having a medical interpreter or translator, but it's important to have that information in writing too, because when patients are in the hospital, they're listening to so much information that even having like a good quality medical interpretation, sometimes it's just impossible to expect the patient to retain all that information without having at least something written down so that they can look it over again at home. I'd like to speak about a really impactful experience that I had with medical interpretation. When we let a patient know that they had been diagnosed with stomach cancer, stage 4, the patient's reaction surprised me because instead of being distressed, they seemed relieved. And I thought maybe the patient hadn't really understood the diagnosis. The doctor said that I should ask something directly to the patient if he knew what his diagnosis was. And the patient responded, yes, that I have stage 4 stomach cancer. And even then, I was sure that the patient hadn't really understood. So the doctor asked me again, ask him, do you know what this diagnosis means? And the patient said yes. So it's a matter of like reformulating the question then. And I asked, why did you feel relieved about hearing this diagnosis? And his answer just confirmed what we suspected. He thought that cancer had been detected at an early stage. He thought that the stages were from 1 to 10 and that he was only at stage 4. And at that time, I realized the importance of making sure that the patients not only really hear the diagnosis, but that they really understand what it means. So that experience really shows that interpretation goes beyond just like simply translating words. Medical interpretation means that you have to make sure that the patient really comprehends the diagnosis, not just that they understand. It's really fundamentally important to verify their comprehension. That patient had a mistaken idea of what stage 4 cancer means, and that really would have affected whatever decisions he made about his treatment. So for me, situations like that just show the importance of having medical interpreters that are capable not only in the language, but also different ways of communicating effectively. And besides that, that they just help to underline the importance of understanding your health, using clear language, and speaking openly, so that the patients understand correctly their diagnosis and their treatment. I've also found as well that these like language barriers, you can find different cultural differences. For example, patients who speak Spanish have different perspectives about health, about diseases and treatments. And those perspectives can very much influence their understanding of medical advice and even like medications that have been prescribed. So when those patients find themselves, especially in the United States healthcare system, they are immigrants or maybe they've had previous bad experiences. Those bad experiences continue and they affect the way that they see their health care or the way they receive medical advice. I noticed that one of the problems that our Latinos have, that those that don't speak English, is that there's more of a preference for alternative or traditional medicine over conventional medicine. There's a little bit more resistance to vaccines or medical checkups. So there's the importance of having a doctor who can understand the importance of those things. Otherwise, the patient will not get the care that they really need. Some patients like to use herbal remedies instead of like prescribed medications. And so those can cause conflicts with treatment. Health coverage as well, health insurance coverage, because medical coverage for patients who don't speak English, there are many patients as well who don't completely understand their medical coverage. And that is something else I've seen. I've seen how many people who've gone to get health care when they're working at a hospital, and they do it just because of the incentive. Like maybe they've never even received their medical health insurance card, or they didn't understand the benefits properly. They didn't understand the plan options properly. And so that also prevents them from getting the health care that they need. They haven't taken the time to enroll in a healthcare plan. It's essential for them to understand well the coverage that they have, the associated costs, making sure that they have everything they need for their health. Immigrants can also be afraid that getting the healthcare they need can put them at risk for deportation, and that can also prevent them from getting healthcare, especially if they don't speak the language. There's kind of a disconnect between the patients that don't speak the language and the environment. They're not well informed. They're not connected with services that could help them with their situation. They're not aware of their rights. For example, one patient who finally decided to go look for healthcare realized that he'd gotten even worse and had to end up spending, it ended up being more costly for him. So as a patient navigator, I find a lot of those systemic issues. There is a lack of providers that speak Spanish. That's also a difficulty for patients who are Spanish speaking. Having a provider with whom you feel comfortable speaking your own native language, it can be an impossible mission. The idea of having an interpreter who may not be specialized, that can also affect the quality of your care. There's the possibility of prejudice and discrimination because of ethnicity or language, and that creates barriers for Spanish-speaking patients as well. They can feel that their concerns are ignored or interpreted poorly because of those cultural differences and, cultural and linguistic differences. So access to healthcare is complex. It's very complicated for somebody who doesn't speak the language. Being able to differentiate, questions that are asked at registration versus documents that have been translated into Spanish. The limitation that those patients have, or Spanish-speaking patients have, with the language, that also has an emotional effect. Because mental health, for example, like depression, like the lack of connection, loneliness, feeling stigmatized, because you have the necessity for like a mental health provider, sometimes those people don't look for help. And that can be affected by language barrier. If you are trying to express your feelings, your psychological feelings without a qualified interpreter, it's not possible. And the stress produced by that system as well, and the linguistic barriers, those challenges, financial challenges, all of that increases anxiety, especially for people who don't speak the language. A patient with depression is going to avoid going to a doctor about it because there are cultural differences to mental health as well. They're not going to want to take medicine because they think it's a sign of weakness. And they're never going to want to comment this kind of thing to a family member that they need help just because of that same cultural aspect. There are also a lot of institutional barriers. There's a lack of bilingual staff. People at the reception or nurses who speak Spanish. And even though the law is that hospitals provide interpreters, there is still the chance that things get misunderstood, especially for like insurance issues with people who don't speak the language. The lack of training in cultural competence, that does affect the patient-provider relationship. It slows things down. The lack of information in Spanish, all of those things impede access to healthcare for the patient. What can you do if there is no interpreter in your health center? There are many people who go that have limited English proficiency, but these laws demand that staff and providers have a language access program. People who have limited English proficiency are less likely to ask the questions they need to during their medical appointments. And because of that, they tend not to talk as much if they need clarification, if they might not explain how they feel. Thank you.
Muchas gracias, Sandra.
Thank you so much,
Ahora vamos a iniciar
Sandra.
con la sesión de preguntas.
So now we're going to
La
start the
doctora Diamond y
Q&A
Sandra pueden
session.
prender sus cámaras otra vez.
Dr. Diamond and
Los que
Sandra
están en
can
la
turn their
audiencia
cameras
aún
back
pueden
up.
enviar sus preguntas para nuestra oradora usando
You
el
all, as our
botón
audience, you
debajo de pantalla
can
que
feel
dice
free to send
Q&A
in your
o
questions
preguntas y
at
respuestas.
the bottom part of the screen where it says
Intentaremos responder
Q&A.
a todas las preguntas en el tiempo que
We're going to
tengamos
try to
disponible.
respond to all of the
Recuerden
questions
que
in the
los
time we have
oradores no
available,
pueden dar consejos
but
médicos,
remember that the
por lo que
speakers
recomendamos
cannot
que
give
envíen
any
preguntas
medical
generales a
advice.
ellas.
So we're going to try to keep the questions general for them.
También pueden usar el chat si tienen una pregunta.
You can also use the chat if you have any
Nosotros
questions.
recibimos preguntas antes del programa también.
We did receive
Voy a
some
leer la
questions
primera y
before
Dr.
the
Diamond
program.
o Sandra, si quieren
So
responder, por
we can
favor,
start
abran
with
su
those, and
micrófono.
either Dr. Diamond or Sandra, if you would like to respond,
La
you
primera
can.
pregunta es,
The first question
en el clima
is,
político actual, ¿qué consejo
in
puede
today's
compartir
political
para pacientes que
climate,
tienen miedo de ser señalados
what
o
advice can you
discriminados en el
share
mercado?
with patients who might be afraid of being discriminated
Puedo
against or
responder
attacked
primero.
because of not speaking the language? I can
Los
answer
pacientes
first.
tienen derecho al acceso lingüístico en la
Patients have a
atención
right
médica
to
sin importar
language
su estatus
access,
migratorio.
regardless
Puede
of their
solicitar una
migratory
intérprete sin ayuda
status or
y
their
si se
immigration
siente
status.
inseguro, busque ayuda legal
If
o
they feel safe, they can
organizaciones
search for legal help
comunitarias que apoyen los derechos de
in the
los inmigrantes.
community,
Siempre lleven
that
consigo los
organizations that
documentos
support the
médicos
right
importantes
of
y conozcan sus derechos
immigrants.
bajo las leyes federales y estatales.
But they are protected under federal and state laws.
Independientemente del estatus migratorio, los pacientes
Independently
tienen
of
derecho a una
your immigration
consulta
status,
en
you
el
have the right to
entorno
clear
clínico.
communication in
Si
medical
alguien está
environments.
preocupado por sus derechos o su seguridad,
If anyone
puede
is concerned
buscar
about their
orientación
safety,
en organizaciones de asistencia legal como
they
el
can look for help at
o
legal
Centro
organizations
Nacional
such as the
de
ACLU,
Los centros de salud comunitarios y grupos de defensa también pueden
legal community
brindar
help
apoyo e información
centers can help to give
sobre
support
cambios
and
en las
advice
políticas que están cambiando
as far as
rápidamente.
policies that have been changing very quickly.
Gracias, doctora. Sandra, ¿usted también quiere responder a esta pregunta o podemos
Thank you,
continuar?
Dr. Sandra. Do you want to answer this question as well?
Ok, gracias.
Okay, thank you.
Tenemos dos preguntas
We have two
de
questions.
Rebecca. Primero pregunta, ¿qué puedo hacer cuando el tratamiento que da el
What can I
médico
do
es
when
adverso?
the
¿Cómo me puedo expresar con el mismo
treatment
médico que el tratamiento fue
recommended by the
adverso?
doctor caused side effects or adverse effects? How can I communicate that to my doctors?
Si necesitas, I'll answer in English. Just to clarify, are we saying that the treatment, they want to tell the doctor the treatment's bothering them?
Yes,
like
how
they
do
have
they
a bad side
communicate?
effect.
How do they communicate that a treatment was adverse?
Yeah. I think always ask for an interpreter, and the doctors want to know if the treatment is affecting you badly. One of the things we've learned in cancer treatment is that when we find out that somebody's having difficulty with their treatment and we act on it, meaning we give them medications to help if they're nauseated or maybe give them more pain medicine if they have pain, whatever, it helps them to finish their treatment if we know about your symptoms. And if you finish your treatment, you're more likely to do well and to survive and to have fewer complications later on. So we need to know if the treatment is adverse for you so that you can get the right adjustments made or maybe change so that you can be successful with your treatment.
Gracias. La segunda pregunta que recibimos
Thank you.
fue,
The second question we
si no hay
received was
traductores en el centro que
if there
asisto,
are no
¿existen organizaciones
available
que ayuden con la traducción
interpreters
médica?
at this center, other organizations that can help with medical interpretation.
Muchos hospitales están obligados
Many
por
hospitals
ley
are
a
obligated by
proporcionar
law
servicios de
to
interpretación.
provide interpretation services. If there are no interpreters available, they can request remote interpretation through over the phone or over
Ajá, algunos
video.
programas de
Sandra?
Medicaid, por ejemplo,
Some
incluyen
Medicaid
también
programs
intérpretes. Hay
include
algunas organizaciones sin fines
interpreters
de
too. There
lucro,
are
como
some
Caridades
NGOs,
Católicas,
such as
el Comité de
Catholic
Recetarios
Charities,
Internacionales, que son los que trabajan con todas las personas
and
que han
other
solicitado asilo.
charitable
En su
organizations that
país
work with
se
asylum
ofrece ayuda
seekers,
también para refugiados y
um,
migrantes.
also
Hay servicios gratuitos de traducción
centers
virtual.
for
Hay una
refugees. There
organización
are
que se llama,
centers
una
of
compañía que se llama
remote
Line
interpretation.
Solutions. Y ellos
There's
también
a company
ofrecen
called
servicios
Language Line Solutions. They
de
also offer
traducción
language
gratis para
services,
algunos pacientes.
free
Hay aplicaciones
interpretation for
también
some
como
patients.
Google,
There
pero
are some
no tienen
apps
uso muy
such as
limitado
Google, but
para
they
las
have a very
personas que
limited
están
use.
en un sitio donde no
For
hay estos
people
servicios
who
para nada y
are
pueden
at a center where there are
encontrar
no language
apoyo
services available, they
en
may
su
seek
comunidad. Hay
support in the
iglesias, hay centros
community. There are
comunitarios,
churches,
hay
community
organizaciones
centers.
locales que
There
ofrecen
are local
voluntarios para
organizations that
traducción,
may
para
have
acompañar a las personas
volunteers
a sus citas.
to
Esas personas
accompany
interpretan
people to
guías.
their appointments. That would be
Gracias.
some alternatives. Thank you.
Juanita preguntó, ¿se debe hablar con
Juanita
un médico
asked,
si uno
should
quiere
we
ver a
talk
otros
to a
doctores para una
doctor if
segunda
we
opinión?
want to speak to a different doctor and get a second opinion?
¿Eso es algo que se debe comunicar o no?
Is that something that we should convey to the doctor?
Obtener una segunda opinión.
If you want to get a second opinion? Yes.
Puedo contestar en inglés también. I don't know of any doctor that would be offended if somebody wanted to get a second opinion. I always am open to and happy to hear what another doctor has to say. We're trained to work as a team. We're not trained to know everything. And so if you want to get another opinion and bring it back to me, or if you want to go get another opinion and go to the other doctor because you like them better, all of those are okay. I don't know if you're with a doctor who is upset by that, you're with the wrong doctor.
Sandra, ¿le gustaría agregar a esa respuesta?
No, completamente de acuerdo con la doctora Diamond.
I fully
Creo que
agree
para los
with Dr. Diamond.
pacientes
I
es
think
importante
it's important for
entender y
patients to
darse cuenta de que
understand
es
and
su
realize
derecho
that
buscar por una
it's
segunda
their
opinión
right to
y
seek
un
a
doctor
second
que
opinion.
sea un doctor
And
reputable, un
a
doctor serio,
doctor that's a
nunca va a sentir
reputable
que
doctor
es
should never
una decisión
feel
incorrecta.
that it
Los
is a
buenos
wrong
doctores
choice.
antes animan a los pacientes a
Doctors,
buscar
good doctors
posibles
encourage
opiniones
patients
si
to
es
seek
necesario.
a second or even a third opinion if they
Y parte de la pregunta
uh,
que hicieron ahora
uh,
mismo preguntaba sobre el
do
seguro.
so
Vamos
wish.
a pasar a la
There was another
próxima,
question
pero
on
depende del seguro
insurance.
que uno tenga.
It also,
Tiene que hablar
depending
con
on
su
your
doctor si
insurance
quiere ver a otro
uh,
médico.
plan, you have to speak to your
La próxima
insurance
pregunta
company
es, como
if you want
paciente,
a second
¿qué
opinion.
puedo
The
hacer
second
para
question is,
mejorar la
as a
calidad de
patient,
mi
what can
cuidado
I do
médico?
to improve the quality of my medical care?
Sí, doctora, está bien.
Sandra? No
Antes de
problem,
la
doctor.
cita,
I'll go
ya
first.
deben hacer una
If
lista de sus
prior to the
síntomas y
appointment, you
preguntas,
need
¿cierto?
to
Escriba todos sus
write down
síntomas,
your
mándelos
questions and
listado,
your
qué
symptoms.
los
When did
empeora, qué los
those symptoms
mejora, cuál
start?
es su
What's getting better?
intensidad.
What's getting
Usted
worse?
también puede
What's the
preparar
degree of
una lista de
intensity?
preguntas y
You can
preocupaciones para
prepare a list of
asegurarse de no
questions
olvidar nada
concerned to ensure
importante.
you don't forget
Debe
anything important
reunir
during
su
the
historial
visit.
médico. Si
You
usted
you
visita a
have
un
to
nuevo
gather your
médico,
medical history. If
pedir
you
una
see a new
copia de su
doctor,
historial médico, si la tiene
if you have a
disponible,
copy of your medical record,
tenga en cuenta
fantastic.
cuáles son sus diagnósticos
Otherwise, you should
previos,
know
cuáles han sido sus
what's your medical
cirugías,
history,
qué
their
tratamientos han
surgical
recibido.
history,
Si
what
usted tiene resultados
prior
de
treatments
exámenes
you
anteriores,
received. Do you
puede
have any
prepararlos.
prior testing
Por favor,
results,
tenga una lista de sus
reports? Have a
medicamentos, anote
list,
los medicamentos
have
que
your med list
toma,
ready,
cuáles son las
uh,
dosis, cuál es la
the
frecuencia.
dose, the frequency of those
Mencione si toma
medications.
vitaminas, si
Mention
toma
if you take
suplementos, si
supplements
toma remedios
or
naturales.
vitamins, if you
Eh,
take natural
Llame a su
remedies.
seguro médico. Usted
Call your
revise que cubre su
insurance
plan. Si el
company
médico
to
usted ha
ensure
hablado acepta su
what is
seguro,
actually covered if
el
the
día de la
doctor you're going
cita,
to see accepts your
lleve la tarjeta de su
insurance.
seguro, lleve su
Bring your insurance
identificación.
card, bring
Y
your
si usted
ID.
necesita un
And if
intérprete
you
porque no
need an
habla inglés con
interpreter
fluidez,
because you
pregunte al
have
hospital
limited
cuando
English
usted esté
proficiency,
confirmando
ask the
su cita
hospital when you're
si
confirming
esa
your
entidad
appointment
ofrece un
if
intérprete.
that
Recuerde que si
organization
no tiene uno
offers
disponible
interpreters
todo el
and
tiempo,
ask
sí
if
puede
they don't have
programar un
an
intérprete
interpreter
para su
available
visita.
the whole time, if they could actually
También
schedule
considere
it in
llevar un
advance for your
familiar
visit.
y
Consider bringing a family member
buscar apoyo emocional si usted cree
and
que lo va a necesitar.
seek emotional support if you
Cuando
think you're
usted
going to
esté en
need it.
su cita,
When you come to your visit, explain your symptoms with clarity. Be precise. Where does it hurt? When did those symptoms start? How frequently does it happen? Take notes. Don't be afraid to ask questions. What is the diagnosis? What's the cause? What are my treatment options? What are the side effects of the medication that I'm taking? Do I need additional testing or exams? And take your prescribed medications, follow your doctor's recommendations, and remember that this doctor, together with these tools and with good interpretation, will have the necessary information and to establish a diagnosis that you need and choose the most appropriate treatment for you. So it's not just about ensuring good communication. In order to have a smooth communication, we need to be ready to offer all the necessary information so that we receive the best care. Thank you,
Y preguntaron,
Sandra.
fuera
There
del
was another
hospital,
question.
¿y si
Outside
no
the
hay un
hospital,
intérprete en una farmacia y
let's
necesito
say
o tengo preguntas
there are
sobre
no
mi
interpreters at a
prescripción?
pharmacy, or if I have questions about my
¿Qué puedo hacer?
prescription, what can I do
Lo mismo.
at the pharmacy?
Los farmacéuticos,
The same thing, pharmacists,
tener intérpretes también.
they
Y si no
also
hay
need to have
personas,
interpreter
pues
services
probablemente no
available. And if they don't have
para la farmacia,
in-person
pero
interpreters, probably not at a
si
pharmacy,
no hay, ellos pueden llamar por teléfono
they should
a
have a phone line
y
to get an
necesitan.
interpreter on the
Así
phone.
es.
And it's the law. They have to. Thank you.
Esta pregunta es para la doctora
This
Diamond.
question is for Dr.
Doctora,
Diamond.
¿cuáles son las ideas
Doctor,
principales que
what
usted
are
quiere
the
impartir
main
a los
ideas that you would
visitantes
like
aquí
to
hoy?
convey to the participants here today?
Su derecho a un intérprete médico.
Your right to a medical interpreter. It's your right. Hospitals and clinics, pharmacists must provide this service free of charge. Use a qualified professional interpreter. Do not use friends or family members to interpret. Your privacy is protected. These interpreters will keep your information private. Request an interpreter. You may do so in person, over the phone, or through video. Better communication equals better health outcomes. Understanding your care helps you make better decisions.
Y Sandra,
Thank
¿tiene
you.
alguna
And
enseñanza o
Sandra,
mensaje final que quiere
any
compartir?
final comments or messages for the
nosotros
audience?
tenemos la expectativa de
Given
que
our
los
culture, we
proveedores
always
deben
expect
saber y
that
entender todo
healthcare
acerca de
providers
nuestros
understand
orígenes
everything
culturales,
about our culture,
nuestra idiosincrasia, nuestras
background, our
prácticas.
idiosyncrasies, our
Así que la
practices.
unidad cultural debe reconocer que el
So
proveedor de cuidado médico no es un
the
experto en
healthcare
nuestra
provider must
cultura
acknowledge that
y
he's not an
depende de
expert
nuestra
in our
comunicación con
culture,
el
and
doctor que
he or she
podamos
has to
recibir
rely
el
upon our
cuidado
communication
que
so that we can
necesitamos y que
receive the care
merecemos.
that we need.
Yo amo mi trabajo,
I love
amo el
my
impacto que tiene en
job.
la vida
I
de nuestros
love the
pacientes y amo
impact
saber
it
que
has
desde mi
on
experiencia personal
patients' lives,
yo
and
puedo ofrecer como
I
un
think through my personal
acompañamiento
experience, I can
empático,
really provide
asertivo y efectivo
empathetic
y
support.
ser navegadora de
Um,
pacientes no es solo un empleo para mí,
and being a
es
patient
mi
navigator is not
pasión, mi
just a job;
propósito
it's
y mi
something I'm
manera de
very passionate
transformar una
about,
experiencia
and it's
difícil
the
en
way
una
of
oportunidad para ayudar a
turning
otros.
a difficult
Sé que
experience
muchos intérpretes
into an
tienen
opportunity to
posiciones de
help
la
others.
misma forma.
I know that
Estamos
many
en un
medical
empleo
interpreters
sin
feel the same way. This is not
representación
just a job, but
y
it's our
por
passion.
eso quiero que todos los
And that's
pacientes
why
no tengan miedo de pedir un
I would like
navegador, no
every
tengan miedo de
patient
pedir un
to
intérprete
not be
clínico,
afraid to
porque
ask
realmente
for a
somos personas
navigator,
que
to
amamos
ask
nuestro
for a
trabajo
medical
y
interpreter,
queremos
because we
ayudar a
really
muchas
love our
familias.
job. And you can count on us
Sandra.
always.
Ahora
Thank you,
tenemos una
Sandra.
última pregunta,
And
pero
now
tiene
we
que
have a
ser
final
antes de
question
concluir el seminario.
for the audience before we wrap up.
¿Están familiarizados con los
Are you
servicios de
familiar
navegación del
with patient
paciente y con sus
navigation
derechos legales?
services and your legal rights?
Vamos a dar unos minutos para
We'll
contestar.
give you a minute to answer this question.
¿Sí? Vemos que el 100% de ustedes dicen
Okay,
que
so we
sí,
see
están
that
familiarizados con
100%
los servicios de navegación al paciente
is
y sus derechos legales.
familiar
Les
with
alegra
patient
ver que
navigation
esta
services and
solución
legal
pudo
rights.
enseñar
We're pleased to,
información valiosa y les pudo
um,
ayudar.
we hope that this
Gracias, doctor
presentation
Diamond.
provided
Muchas
valuable
gracias, Sandra,
information.
por esta
Thank you,
presentación
Dr. Diamond.
informativa
Thank you, Sandra,
y
for
gracias a todos por participar y
your
enviar sus preguntas.
presentations. Thank you all for
Queremos
participating and for
informarles
sending your
que la
questions.
grabación de
We would
este
like to
programa
inform you
estará
that
disponible en la
this
página web
program
de SHARE
has been
y de
recorded and it
MSD
will be
en 1 o
available
2
at
semanas,
Share and
pero que
MSK's
también van a
websites in
recibir
1 to
esta
2 weeks.
grabación por
You will
correo
also
si se
receive
registraron al evento.
this recording if you were
Por favor, tomen un
registered. You will
momento para completar
receive
un
it by
encuesta al
mail.
final del
Please take a
seminario.
moment to
Sus respuestas serán
respond
anónimas y
to
nos ayudarán para planear
a
futuros
quick
programas.
survey.
Esto
The
concluye mi
answers will be
presentación.
anonymous
Gracias por
and they will
participar
help
y
us
que
with
tengan
future
buena
workshops.
tarde.
Thank you for participating and have a wonderful evening.